Hi everyone, I am Ali Bassir. I am a research fellow in the Department of Radiology at UCLA. I would like to present our study, which is Diagnostic Performance of Contrast Enhanced Ultrasound, or CEUS, for detection of hepatocellular carcinoma. CEUS-LI-RADS compared to WFUMB-EFSUMB on Lumason and Definity subcohorts. Contrast-enhanced ultrasound is a safe, robust, and cost-effective imaging modality that allows real-time characterization of hepatocellular carcinoma. Lumason and Definity are FDA approved and the most common contrast agent for this modality. American College of Radiology developed the CEUS-LI-RADS in 2014. The goal of this CEUS-LI-RADS are to reduce variability between observation and improve the diagnostic accuracy of HCC. World Federation for Ultrasound in Medicine and Biology, WFUMB, and European Federation for Society for Ultrasound in Medicine and Biology, EFSUMB protocol, first introduced in 2004 and defined criteria for better detection of liver cancers. There are several phases for CEUS study, and the most important ones are arterial and portal venous phases. Arterial phase starts 10 to 20 seconds after injection and end at 30 to 40 seconds. After arterial phase, the portal venous phase starts. Arterial phase hyperenhancements defined as enhancement greater than background in arterial phase, and washout is a temporal reduction in portal venous phase or late phase. Timing and quality of washout are important. Two main protocols for evaluation of liver lesions are CEUS-LI-RADS and WFUMB. CEUS-LI-RADS have several categories according to size, type of arterial phase hyperenhancements, and washouts. CEUS-LR5 is considered a radiologic definite HCC diagnosis. WFUMB criteria defined a typical CEUS pattern of HCC as hyperenhancement in arterial phase, regardless of type, followed by washout in portal venous phase. The aim of this study is evaluation of diagnostic performance of CEUS-LI-RADS versus WFUMB in the detection of liver lesions in patients at high risk of HCC. In addition, we compared the diagnostic performance of two protocols in subcohorts of lesion studied with Lumason versus Definity as contrast agents. Our retrospective study cohort involved patients at risk for HCC who presented with untreated hepatic lesion between 2015 to 2021. All patients had underlying liver disorder with an elevated risk of HCC, excluding congenital or vascular etiologies. Our inclusion and exclusion criteria of the two protocols were implemented. Two blinded abdominal radiologists classified each detected lesion per both CEUS-LI-RADS and WFUMB classification. The study cohort was subdivided into Definity and Lumason subcohorts based on the contrast used. The diagnostic performance of two protocols in all lesions and in both CEUS subcohorts was assessed using histopathology and CT MRI as reference standards. Our study included 150 patients with 155 lesions. You can see demographic and clinical information of patients here. The mean age of patient was 71 years, and the majority were male. ECOG grade 1 and child PEG class A were the most common among patients. The main etiologies of liver disease were HCV and HBV. We assessed the inter-reader agreements between the radiologists using kappa test. The kappa coefficient for LI-RAD was 0.82 and for WFUMB was 0.86. According to Landis and Koch kappa interpretation scale, the inter-reader agreement using both protocols were almost perfect. We compared the diagnostic performance of two protocols. The sensitivity of WFUMB was higher than LI-RAD in detecting HCC lesion, 86 versus 76. In contrast, the specificity of CEUS-LI-RAD was higher than WFUMB, 94 versus 80. The area under curve of LI-RAD was marginally higher than WFUMB, 0.85 versus 0.83. Finally, the accuracy of WFUMB was higher than LI-RAD, 85 versus 80. We also compared the diagnostic performance of two protocols in the DEFINITY and Lumason subcohorts. Using the LI-RAD protocol, sensitivity, specificity, area under curve, and accuracy were higher in the Lumason subcohort versus the DEFINITY subcohort. The same trend was observed using the WFUMB protocol, and sensitivity, specificity, area under curve, and accuracy were higher in the Lumason subcohort versus the DEFINITY subcohort. This figure shows the ROC curve for two protocols in two subcohorts. The CEUS-LI-RAD in the Lumason subcohort had the best performance. In conclusion, contrast-enhanced ultrasonography is an advanced diagnostic method that offers dynamic real-time assessments for detection of liver lesion in patients at risk of HCC. CEUS showed a favorable diagnostic performance for diagnosis of HCC in patients at risk. CEUS-LI-RADS has a slightly better overall performance in comparison with WFUMB criteria, although it has lower sensitivity and accuracy. In Lumason subcohort, a greater performance and accuracy were observed in both protocols in comparison with DEFINITY subcohorts. Thank you for your attention.